What is the first and most important piece of advice you give to every patient who walks into Kamya Aesthetics for the very first time?
Okay, so that's a very wonderful question. Actually, when we start talking about clients, we assess what they do to their skin, what is their basic skincare routine, and one of the things that we've found across the board is that they do not use sunscreen. They think that using a sunscreen is an optional requirement. So I cannot emphasize how important it is that you use a sunscreen, that to an SPF 50, whether it is dark outside, whether it is sunny, windy, rainy, you're in Jaipur, you're in Calcutta, you're in Amsterdam, anywhere in the world you go, one of the basic essential things that you need to do for your skincare is apply sunscreen. That too an SPF 50. A good quality sunscreen will not leave a white tinge, it will get absorbed easily. So these days with my clients coming in, what I've told them is that take a moisturizer based sunscreen and use it instead of a moisturizer.
What exactly is a hydrofacial and how is it different from other normal facials?
So I would say hydrofacial is a very deep level cleaning of your skin, and the process itself that we have at Kamya Aesthetics is a 12-step process. So each process basically cleans the skin layers, cleans your pores, cleanses your pores, microdermabrasion, and then we infuse the serums. We get your skin into a very plump, glowing format. And so how is it different than other facials? So it's called a facial, but if you go to a normal salon and you get a normal facial, the effect is very superficial and it lasts for maybe a day or two. But with the hydrofacial, because it's a very deep level cleansing and a deep infusion of serums and products, it lasts for 8 to 10 days. And then here at Kamya, what we do is whenever we go for any kind of treatments, laser-based treatments, we do a basic level hydro cleansing first, so that we get a very clean layer of skin exposure to do any kind of treatments. And so they're more effective, and you get that glow.
I am considering laser hair reduction. What is the one thing most people don't know about the process before they start?
Okay. So there are a lot of myths about laser hair reduction, and one of them being it's a radiation that is being passed through the skin, and it's like an X-ray or something. No, laser light is very, very different than an X-ray light. It is a non-ionizing radiation, so you'll not get cancer or anything that you're exposed to it. In fact, it is a very perfectly safe part of a frequency of the white light. So it is very safe, it is very effective, and I would say it's a must for all the working ladies to get rid of the hassle of getting waxing done every 30-35 days. I really recommend laser hair reduction, and it is one of the most safest, easiest, painless ways for 90 to 95% reduction of hair across your body. So when a client comes in for a HIFU treatment, which is basically high intensity frequency ultrasound, which is one of the best treatments, non-invasive treatments for facelift, double chin, sagging jaws. So what we first do is we do a basic analysis. We discuss with the client and we see why it's needed, what are their goals. We assess their skin type, we see their laxity levels, and then we recommend HIFU and what process will take. The contraindications of things that we check out, or when HIFU is not recommended, are basically if the client is pregnant or they're breastfeeding, then they have any kind of metal implants or a pacemaker. In those circumstances, we do not recommend HIFU at all. Also, we check if the patient has any kind of autoimmune disease or has a severe tendency for keloid formations. Then also we say HIFU is not recommended. After these things are done, then we assess the skin type, if there are any kind of open pores or open scars, wounds, and then the laxity level. We take the pre-photograph to see how and where all HIFU treatment is required.